once we have a patient who's stable enough to sit at the edge of the bed with a little bit or no assistance, then we're ready to start moving on to transfers. Some of the tricks of transfers after being down for a while is not just strength, but having the control, being able to have the timing for the muscles to kick in at the right point. And a lot of times after laying fairly flat or at least reclined for a while, people have a really hard time knowing where upright is and get really fearful of coming forward at all. So we probably would have been working on that a little bit for a while, just because most patients when you first get them up are pushing back because they're afraid you're going to pull them forward onto the floor. The first thing we'll do is we'll get them sitting right for standing. So yep, we're going to get your feet apart a little bit. We're going to come forward. So one hip at a time. Yep, you're going to lean onto this arm and bring this hip forward. Good. And lean onto this arm and bring this hip forward. Good. Get those feet flat. We're going to come forward just a little bit more even. Good. Want to make sure he doesn't fall off the bed, but want to make sure that he's got far enough forward that he's going to be able to get his weight up and stand. All right. So if he was having a hard time coming forward, which clearly right now he's not, although he could be a little bit more upright, there we go. We can do different things where I'm going to have him hold on here. Yep. I'm going to have you push me away. I'm going to resist you, but you're going to win. Keep going, keep going, keep going, keep going. Good. And then back the other way. Let me win. Good. One more time. Pushing forward. Good. And I can kind of play with that resistance, really getting him to kick that trunk in. Good. And even the different sides and things, try to get some twisting in or untwisting. Go ahead and put your hands down. Okay. The other thing too, because to stand you really need to come forward. I'm going to have you sit nice and tall and upright. Okay. I'm going to resist you. Don't let me move you. Be a statue. Don't let me move you. I'm going to change directions, but you're straight, you're still, you're strong. Good. And really just trying to get him to kick in so that trunk is strong and stable so that he can push off of it. Good. All right. So we're going to stand up. You're going to push from the bed. Okay. And I'm going to help you as much as you need to, but as little as possible. Okay. So on the count of 3, you're going to lean forward and push up.
Okay.
1, 2, 3. Leaning forward, push, 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 push with those hips. Good. We're going to get nice and tall. You can hold on to my arm if you want. Good. Often I'll have a walker for people to hold on to for the stability. And we're going to sit back down. Reach down with that hand. Nice and easy. Control it. Good. All right, so then once we've got some standing in place, and I know that he can take his weight and shift a little bit, we're going to look at going to a chair. So I'm going to have my nurse come around and help me manage lines or therapy aid, whoever's available. And we're going to put the chair right next to the bed, which means we've got to get this IV here. Got to move the line back a little bit. Make sure we've got enough line. So, there we go. Okay. So where we're going to go from here, let's bring this hip forward a little bit more. Just this one. There you go. Bring your feet in a good spot here. All right. Push those feet into the floor. In fact, I want you, we're going to put this one right here. Don't let me lift this leg off the floor. Good. Hold it strong. Hold it strong. Nice. We're going to do the same on this one. See if we can get some good firing there in the glutes. Good. Okay, we're going to do the same thing where we're going to stand. And then once we're up, we're going to shift over towards the chair. I'm going to have my foot here so I can help make sure everything stays where it's supposed to. And one of the things you can do is you can actually reach onto here once you push off the bed.
Okay.
And then you can disconnect your blood pressure too. Okay. Ready? Here we go. 1, 2, and 3. Forward, forward, push, push, push. Hand on my arm if you need to. You're going to, bring that foot back. Good. Reach for the chair. And nice and easy. Sitting down, right there. You've got it. And sit. Good. Sit back, relax, and we're there.